Hello, everybody. Welcome back to Let's Talk About Sleep. Let's talk about sleep. The link is in the description box below to Amazon. Welcome back. So, what I wanted to talk today about, in kind of going along with this theme of what I've been talking about the last two videos, is obstructive sleep apnea. I kind of prematurely talked about CPAP cleaners without actually talking about CPAP, so that's kind of what we're going to be talking about today. CPAPs themselves, autopaps or APAP, and travel CPAP machines. Okay, so that's what we're going to go over today. As I always say, these videos are for educational purposes only. If you hear something, that kind of sparks something you want to talk about, I urge you to talk to your provider about that. And as always, if there's any possibility of sleep apnea, get tested. It's really not bad. I mean, these days we have home tests, and they can be pretty accurate in terms of diagnosis. Maybe I'll talk about that in the next video. But today we're going to talk about CPAP, and just to kind of reiterate from previous videos, obstructive sleep apnea is where the airway is closing off down here, okay, behind the tongue. Retrolingually is what they call it. Okay, so our goal is to get the airway open, right? To open up that space. So if we're awake, this is what our airway looks like. When we're asleep and the muscles relax, they kind of fall together, okay? Here is where snoring happens, okay, where the airway is tight. And then here is sleep apnea, where the airway is closed off. Okay, so any kind of treatment that we use for sleep apnea is also, by virtue, going to help with snoring as well. Okay, so what is CPAP machine? So CPAPs have been around since about 1982 or so, and what they stand for is continuous positive airway pressure. So CPAP, okay, continuous positive airway pressure. And what they are is basically just pressurized air. Okay, like I said in the last video, this is not oxygen. It's not like you're getting, a nasal cannula like you're in the hospital or in the ICU getting oxygen pumped into you. This is just air. And what these machines do is the pressurized air comes in to the nose, okay, either through nasal pillows or the little prongs that sit in the nostrils, nasal mask, which goes over the nose, or a full face mask, which goes over the nose and the mouth. In all three circumstances, what you're getting is pressurized air. The pressurized air comes in, goes all the way down to the back of the throat, and that space back here where there's a blockage forces it open. Okay, so the snoring is going to go away, but more importantly, the sleep apnea is going to go away. Now, in the kind of standard way, continuous pressure is what we use, right? So one continuous setting, one stream of pressure. And what that pressure does, it keeps the airway open. It doesn't breathe for the person, but it allows them to breathe without without that obstruction happening. So it's one continuous stream of air. They're breathing in, they're breathing out against this pressure. Now, people always say, well, isn't that going to be, is that uncomfortable? And typically what happens is, assuming that the pressure is right, people get used to it, okay? Again, because they know, especially when they're on their back, the airway is wide open, it actually becomes a comforting thing. So nowadays, the machines that we use, they're probably about the size of a clock radio or so. They sit on the nightstand, and like I said, they're attached to a 6-foot-long tube attached then to this mask. They're quiet, they're small, they're definitely travel friendly. Okay, these are questions that I always get. And a bed partner who's complaining about the person snoring, they're going to find that this is much, 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 much quieter. Okay? So that's kind of the standard unit, is a continuous positive airway pressure CPAP machine. Now, we have autopaps. That's APAP, auto-adjusting positive airway pressure. What these are, same idea, okay, pressurized air. But what we do here in this case is we set a range. Okay, so continuous positive pressure, that's one setting, and that doesn't change. An auto-adjusting machine, that sets a range. Okay, so let's say a typical CPAP machine, it's based on what we call centimeters of water. That's how pressurized it is. A typical CPAP machine is going to anywhere between 4 to, let's say, 20 or 22 or 24. Okay, that's the level of pressure. The higher the setting, the more pressurized the air. An auto-adjusting machine will have a range that a provider will set based on either what they think will work or empirical information, and that can range anywhere from, again, 4 to, let's say, 20. Okay, so what happens with an auto-adjusting machine is these are kind of like smart devices. So if the machine senses that there is a blockage, the pressure will go up, and if not, a pressure will go down. Okay, so all throughout the night, the range is kind of being adjusted, okay, on the fly. These are different than BiPAP, which I'll talk about in another video. Okay, that's a totally different thing. But auto-adjusting machines, though, they're great where, nowadays insurance companies run medicine. Providers don't, unfortunately. So what happens a lot of times is the patients will come in, we'll have to do a home test, okay, which kind of lets us know quick and dirty way this person is having obstructive sleep apnea. Then to kind of not waste time, what I'll do in a lot of cases is just prescribe an auto PAP, okay, and the patient will get that at home at a range of pressures that I choose, and that in majority of cases will do enough. Okay, again, if the machine is sensing the person has apneas, the pressure will go up. If not, the pressure will go down. Okay, all throughout the night, and it tends to work well. And what's nice about all these devices that we're talking about is these days I can go online and check the person's settings. I can see how effective it is, right? So I can make changes if we need to. All right, so it's actually very, very very efficient these days. Okay, so that's what an auto-adjusting CPAP is. Now, a travel CPAP or a travel auto-PAP, okay, these are even smaller units than what we have at home. Okay, so let's say instead of it looking like a clock radio or a big clock radio, right, it looks more like probably the size of almost like a smartphone these days. Okay, but wider, but same dimensions. Okay, and basically what these do, the exact same thing: pressurized air coming into a mask and whatever. Now the problem with travel CPAPs are a few. One is they don't really have great humidification. So the auto PAP, the CPAP, they all have a capability where you put distilled water in, and that allows for the air that you're breathing in to be humidified. So that makes it a little bit more comfortable. It doesn't allow for dryness of the nasal passages as much, or of the mouth as much as you would see otherwise. So if somebody is relying on humidification to be comfortable, a travel machine may not be great in that case. The second thing is that insurances don't cover them, usually. Okay, so these are usually paid for out of pocket, and they're $1,000 in some cases, $500 to $1,000. But if you're somebody who has the means and you travel a lot, this might be an option for you. Okay, but it's not. People always ask me, well, isn't it better to just have a smaller thing? And not necessarily. Okay, for these reasons. But the idea is the same, right? It's pressurized air, either continuous or adjusting, and in many cases we can get it linked to our system, so I can just see how the person's doing with it. Okay, but either way, though, the idea is the same. Pressurized air forces the airway open, reduces the snoring and the sleep apnea. Okay, so that's the video for today. That's PAP, positive airway pressure, in various different formulations. Okay, so if you like this, please click like, please share it with your friends and family, please subscribe to my channel, and until next time, sleep well.